my name is Stephanie Stewart. I'm a registered nurse, and I actually teach nursing college in St. Joseph here at Missouri Western. And I started the Parkinson's program here at Freudenthal Center for Parkinson's Disease.
I'm Dr. Elizabeth Stegemoller from Iowa State University. I'm assistant professor there, and I am a board-certified music therapist, and my PhD is in neuroscience. And I have focused on doing Parkinson's research for the last 10 plus years, and my primary focus is understanding how music can improve motor symptoms and other non-motor symptoms and quality of life for people that are currently living with Parkinson's disease.
So tell us a little bit about what got you started with matching music therapy, singing up with Parkinson's disease.
So during my postdoc, I was on a grant that was with the kinesiology department, but also with speech and communication sciences. So I was working with some speech therapists, and one in particular focused on swallow, and then a second colleague focused on vocal health. And I was meeting with them, and they're like, so, what do you think about singing? Do you think it can improve swallow? And so the music therapist in me was like, yeah, sure, it can. But there wasn't really any evidence behind it, and there wasn't any research. And so we started to collaborate. We collected a little bit of pilot data, and then we put in for a grant to look at the effects of singing on the voice and swallow and respiratory control. So that's kind of how it got started.
So what do you think, if somebody was out there and really didn't understand how music and singing is helping somebody with Parkinson's disease, how do we convince them that, yes, this could potentially really alter your life in a positive way?
Yeah. So the main reason, you go to the doctors, and the doctors say you need to exercise. And everybody thinks, well, okay, I'm going to go exercise the big muscle groups. And that's great. You can do boxing, yoga, dance, all kinds of different exercises. But the muscles that control the swallowing and the respiratory control are also affected by Parkinson's disease. And we need to exercise those muscles as well. And one of the best ways to do that is to do vocal exercises and sing, because they use those same muscle groups when you're singing and when you're doing vocal exercises. So I always tell people that they need to think of singing as exercise for those other muscles, because complications from swallowing is a leading cause of death in people with Parkinson's disease. So you get liquids, thin liquids or other material that can seep down into the lungs. And if you can't cough them out, because you need those muscles to cough them out, then you're going to get aspiration pneumonia, and that is detrimental. And so by singing, we work on breath support, and we work on proper support using those respiratory muscles, the same ones you would use for cough. But we also use the same muscles in singing that you use for swallowing. And so it's basically exercise for those other muscles.
For the small muscles.
Yep.
Interesting. So talk a little bit about how you think. Have you done any studies? Have you looked at quality of life for people with Parkinson's and how singing impacts quality of life?
Yeah. So we have done, in the first study, we did 3 matrices of quality of life. So we did voice quality of life, swallow quality of life, and whole health quality of life. So the quality of life measure that improved significantly after 8 weeks of singing was the whole health. So we see that the entire, all aspects of quality of life significantly improved after singing. And then we did kind of a qualitative study after that, and we asked the participants what did they get from the study, because we know it helped swallow, we know that it helped the respiratory control and the voice, and they kind of knew that, but that's not what they said was the best part of singing. They said the best part of the singing is they felt like they were less stressed, they felt less depressed, and they had a sense of camaraderie with other people that were in the group. They felt like they were with people that understood what they were going through and were all working in a positive manner towards doing something to fight the disease. I can tell you one cool thing about music that that might also help. And the most people, so the research has shown that music, actually being involved with preferred music and actively involved with preferred music, increases dopamine production in the brain. And so with Parkinson's disease, we have reduced dopamine levels, which is why you take those meds. And with singing, we can actually increase dopamine and look at, and while it might be in a different area of the brain, when you take your pill, you don't know where it's going. You're hoping that it's going to the right spot. And so that's the same thing with the particular area of the brain that's involved with preferred music. It's also the pleasure area, so it makes you feel better and feel happier as well.
So talk about what preferred music means.
Music you like. So, and yeah, pretty much music like, the song that you turn on the radio and you're like, woohoo, I'm going to sing along. And you're, the red light and everybody's staring at you. Okay, well, that's all right. So that's preferred music, that music that you really are motivated by. And that's one of the aspects of a good, we call them group therapeutic singing, is that we often, after like the first several weeks where we just kind of start off with starter exercises to build up your strength for singing, then we transition into a lot of participant requested music. So a lot of times in my groups, I'm like, any requests? I feel like I should put a hat out. And then they will request, and it'll be different people's, everybody has different styles that they enjoy, but we do see that, but everyone kind of goes with it and will sing because they know that that's that person's favorite song.
Talk to us a little bit about the participants that you're seeing that are coming to your music groups. Gender, age, just some different qualities about them.
Well, we have all kinds. So we started off with more females than males, but now we seem to have more men than women. And we have anywhere from 60 or younger to 85. We had a lady that just turned 90, but she can't make it anymore. So we have the full gamut of age ranges, and especially for the singing group, we have full gamut of mobility from wheelchair bound to no problems whatsoever. And we have people that have been singing with me for 6 years, and some people that have just started singing in January. So it's a large variety of people, ages, and we have a little bit more, some multicultural aspect in the group with different cultures. And we also encourage caregivers to come. And sometimes the caregivers will stay and sing, and other times the caregivers will just meet on their own in another room, which is actually kind of nice for them to have that time.
Absolutely. And so you've done a little bit also with telehealth and putting the video out there and letting other leaders in the different communities kind of start those groups. Talk to us a little bit about that.
Yeah. So after the results of the first study came out and they got picked up, a lot of people were like, well, can we do a group here? Can we do a group here? And I was like, I can't be everywhere, so I have to figure out a way to start training other people or giving them the resources that they need so they can start their own group. And so Iowa State is a land-grant university, so extension and outreach is a big part of our entire program. And so we have extension officers in 99 counties and our extension specialists in all 99 counties in Iowa. And so I had a grant from Extension to do telehealth, where we videoed the 8 sessions that were the same 8 sessions that were in the original study. And I used my group, and we videoed them, followed the same protocol for the study, and then that eliminated the need for music therapists to be there to lead the groups or someone. So they actually just met in their local communities, went to some very rural local communities at their local church, and extension officer basically hit play and we did, and they did the 8-week sessions that way. My research team went up before and after the 8 weeks and collected data, so we wanted to see how that program compared to the live program, and we recently published that, where we see very similar results using the telemedicine, the 8-week training videos to the live. And it's hoped that our next step is to try to, after the 8 weeks, to get people to then use Skype or Zoom or something like that to connect to a live group that's already going and continue to sing.
Our plan with the Freudenthal Center for Parkinson's Disease is to do an 8-week program of vocal exercises at the mall, and hopefully have some amazing outcomes with this program so that people can have a higher quality of life.
Come to a singing group here, right?
Come sing with us!
Yes! It's going to be awesome.
It is going to be awesome.